the Republican-led bill that was released late last week will get a vote. There also could be other votes, though, in terms of a discharge petition. There was another extension to the ACA that at one point was promised to bring to a floor vote. Now it might not happen. Do you have a clear view of what this week will look like?
Well, here's the thing with those discharge positions. Actually, let's just take a step back on these enhanced premium tax credits, because a lot of the rhetoric that we see on social media from headlines from people pushing back is we have to do something or premiums are going up. Premiums already went up. The open enrollment period is over. I mean, that's already baked in. For those who don't understand how this works, the payers, the insurance companies, they file with their states months before the open enrollment period. It gets approved. It gets filed with CMS, the Center for Medicare and Medicaid Services, and then comes the open enrollment period where you pick your policy for the next policy year starting January 1st. That's over. And so this whole argument about if we don't do something by the 31st, then suddenly premiums are going to go up. Well, I'm going to tell you, if the enhanced premium tax credits, if the Obamacare tax credits expire, rates have gone up. If they get extended, rates have gone up. It's the same thing no matter what. But here's the thing the folks aren't talking about is the chaos.
So they wouldn't, just to be clear before you go on, they wouldn't come back down through some sort of retroactive language and legislation?
Well, so let's just think about what would have to happen mechanically.
Yes.
Is first of all, you'd have to have the payers, the insurance companies, refile their rates.
Okay, yes,
so let's say we get into that, by February. So those get reviewed, those get filed. So then you have to have another open enrollment period. And that's going to create confusion in the marketplace, because people who pay a portion of their small group or large group through their employers are going to think, well, hey, I'm going to get a discount too. But no, this only affects the individual market, so it's a small percentage. So then you have to have an open enrollment period. Let's say that's March or April or whenever they can do that. So then do you make it ex post facto going back to January 1st? Do you have it going forward? But it creates confusion in the market, and I'm not exactly sure how we would deal with that mechanically. But then let's look at what happens if we just extend the tax credits. Let's say we extend them for 2 years. Well, then everybody refiles next spring. We have another open enrollment period, November, December, and that goes into the 2027 policy year, which will probably still be a little bit of an increase, because here's one thing that the Republicans and the Democrats all agree on right now is ACA, the Affordable Care Act, Obamacare has been a complete failure, and rates have gone up independent of these tax credits. They're going up no matter what, because the cost of health care has gone up. And what's happened is the cost of health care goes up, of course the cost of health insurance goes up.
Yes.
And when that happens, people start coming off and they find alternatives. Either they go uninsured, or they find an alternative like a health sharing ministry or some other thing. And it's not the healthy people. I mean, it's not the sick people that come off, it's the healthy people. So the younger, healthier people come off, and that creates this phenomenon called adverse selection. So then you've concentrated the risk, losses go higher, and the next premium year, premiums go higher. And that creates this whole cycle.
Is brutal. And our audience should know you were state auditor overseeing this very matter in the state of Montana. So you have a unique understanding of all of this stuff. KFF says the expiration would more than double on average what people are paying annually. President Trump would say, keying off of what you just described, then so send people the money instead of the insurance companies. But don't people lose power by having essentially an individual barter with this massive insurance company? How does that keep premiums
Well,
down?
first of all, let's just correct the record on one thing. The actual rates that have gone up in just the individual market, so just a small fraction of the overall market, on average, well, in Montana, on average, is about 22%. And the enhanced premium tax credit, the Obamacare tax bracket, that's single digits of that. So it does have an effect, but the rates are going up with or without that. So first of all, just make sure that the people understand that. And then in terms of the healthcare savings accounts that the president's talking about, personally, I think there's meat on the bone there.
But they're not going to be in this bill?
They're not going to be in this bill, unfortunately, but this is something that we need
to... That's like the Bill Cassidy plan is something that you would warm up to.
Well, I think there's meat on the bone here for a very simple reason. One of the issues that we have is we've created so much distance between the doctor and the patient. There's so much in between there. And what an HSA does is you've got a finite amount of money for paying for your out-of-pocket expenses, for your medical expenses, and it can only be used for that. And so now you're saying, I've got $5,000 in there, or however much that money is, and you're talking to your doctor, and you're saying, well, how much does this test cost?
Yeah.
Well, do I really need that? Or the other thing is right now nobody is incentivized to look for actual pricing. So if I talk to Doctor 1 and I say this is going to cost $500, and Doctor 2 says $1,000, it starts to put that in there, because the problem right now is somebody else is going to pay for it. So there's no incentive for somebody to look at what the actual cost they're being charged is, because you know that your insurance company is going to pay it.
And that would be the individual doing that.
So
shopping,
the HSA,
right?
with the HSA, it puts more power. If we start to expand that, it puts more power into the patient in having that conversation with their doctor and actually asking, because now it affects them directly, asking what the prices are, what the tests should be, what the expenses of the. So it brings that in. I just think about, when I was growing up, lived in a single income family, worked in a grocery store, so not a family of high means. And when I'd come out of the doctor, my mom would go up to the front desk and she'd get out her checkbook and write a check.
Yeah.
And that's how we did it, because there was that doctor-patient relationship. And I think we've come so far away from that and put so much money into the system that we've seen the underlying care, cost of health care going up. Economics 101, you put money into a system, things get more expensive. And we've seen that, and that creates that vicious cycle that we talked about with adverse selection.
Well, and a conversation like this gives somebody a popsicle headache, because it's complicated stuff.
It is.
They're trying to figure out, well, what part of this policy is going to help me?
And that's what makes it hard politically, because it is hard to explain.
Because you have to communicate this stuff.
It is hard to explain.
So let's say, all right, so the messaging system breaks down here, and we're looking at a government funding deadline at the end of January. I'm not even going to ask you. Are you worried?
I think, when we had the shutdown, that 43-day shutdown, it was horrible. Nobody wins. Everybody, well, which side won? Did the Republicans win?
We have short memories, Congressman.
Nobody wins in a shutdown. But here's one thing that I will say is at least on my side of the aisle, the Republican conference really stuck together and said, okay, we're not going to negotiate this craziness. They're bringing in all these red herring when this is really a simple, short-term extension of current policy so that we get through the appropriations process.
Is the scar tissue from that experience enough to keep us from doing it again?
I can be hopeful. I really think it is. I think that's going to come into play when I know that the resolve on the Republican side is pretty strong, and I think that the Democrats learn that is not a winning prospect. So I'm hoping that calmer heads come to the table and prevail, and we start to get more of these appropriations bills through. So obviously we just had the National Defense Authorization Act, so that's going to the Senate. Hopefully that moves through. So we're slowly ticking away at these. We'd all be happier if it went faster, but the frustrating thing for me is that when these appropriations bills come out of committee, you got the four corners. They start out bipartisan. It came out of committee with the ranking member and the chair, both the Senate and the House side. So you've already got a bipartisan spending bill. And it's just frustrating that we can't all rally around this, get back, as Speaker Johnson says, the muscle memory of actually appropriating and going through that process rather than continuing CRs and omnibus spending bills. And I think there's a huge desire to get back to that, and I am so hopeful that we can get back to that. And it may not be this cycle, maybe the next cycle, but soon, because the American people want that. The people that voted us into office want that. We all want to get back to that and get back to actually doing our job of regular order.